Hi, hello, welcome back. So today we will be seeing about anatomic pathology. The code series is 8800-88099. So this is a topic which is coming under CPT Pathology. We have added a playlist for CPT topics. Please do have a view. Anatomic Pathology 8800-88099 covers anatomic pathology procedures, specifically autopsies and postmortem examination. These codes are used by pathologists to report the evaluation and the examination of the bodies after death to determine the cause of death. So the key concept includes anatomic pathology, autopsy, specimen type. Anatomic pathology includes the examination of organ, tissues and bodies to diagnose disease and determine the cause of death. Autopsy is a thorough examination of a body after death to know the cause of the death. So categories and examples are autopsy procedure 8800-88099. So you can go through these codes for clearly understanding whether it is a gross examination only or it is with CNS or without CNS, gross examination of brain, like that certain division has been done. You can go through it. So you can see the example. Gross examination, for that gross examination only without CNS, we will be giving 8800. For that the question will be: a pathologist conduct an external and internal examination of the body. You can go see that. Okay, gross examination with CNS example is: a pathologist conduct a complete external and internal examination of the body including the brain. So if it is including the brain, so it is with CNS, we are giving 88005. Gross and microscopic examination without CNS, the question will be: a pathologist performed a detailed external and internal examination of the body and also examines a tissue sample under a microscope excluding the brain. So it is without CNS, so we are giving 88007. And gross and microscopic with brain, the question will be: a pathologist conduct a thorough examination of the body including the brain and examines tissue samples. So it is with brain and using a microscope, we are giving 88020, examination with the brain. And then with brain and spinal cord, a pathologist perform a comprehensive examination of the body including brain and spinal cord with microscopic evaluation, we are giving 88025. The detailed example are like a patient dies unexpectedly and an autopsy is performed to determine the cause of death. The pathologist conduct a gross examination but does not include the brain or spinal cord. So we are giving 8800 without CNS. And example 2, a patient with a history of neurological disease dies and autopsy is performed. The pathologist includes a detailed examination of the brain in addition to microscopic examination of other parts. So it is including the brain, we are giving 88020 with microscopic examination. And comprehensive autopsy, a patient dies under suspicious circumstances and a complete autopsy is required including an examination of the brain and spinal cord. The pathologist perform both gross and microscopic, so we are giving 88025 with brain and spinal cord. So the coding tip is: always use the most specific code that describe the extent of the autopsy, and for the documentation you have to go through all the aspects of the examination of the organ and tissue, go through the medical necessity, and if any additional procedures done, please check. And final conclusion is: understanding and coding an anatomic pathology procedure accurately is essential for proper billing and documentation. Familiarize yourself with the specific code, that is 8800 to 88099. And if you have any questions about a particular code or procedure, please refer your CPT book. Thank you so much for watching. If you haven't subscribed my channel, please do subscribe, and if you have any doubts, please do put it as a comment also. Thank you so much for your time. Take care. Bye bye.